really is amazing to have such a world-renowned NF clinician and researcher with us today, so thank you very much, Professor Korf. Our next speakers are from the Murdoch Children's Research Institute. They are working with our neuropsychology team. Anita Chisholm is a PhD student, and Alice Meyer is with us as the NF Barney Fellow for Research. Thank you very much.
Thank you, Nat, and good morning, and thank you everyone for coming today. Professor Korf is a hard act to follow, but I'll try and do my best. So as Nat said, today I'll be focusing on looking at the cognitive issues in NF1. I'd like to describe to you our role as neuropsychologists in the Nf1 Clinic at the Children's, and also just to briefly describe to you some of the research that we're doing through the Murdoch Children's Research Institute. So for those who aren't familiar with neuropsychology, it's a specialised area of psychology that looks at the cognitive, emotional and behavioural effects of paediatric conditions that may compromise brain functioning, such as NF1. As neuropsychologists, we provide assessment of both cognitive functioning, such as thinking skills, reasoning, problem solving, as well as educational skills that may be affected by NF1. Working. Another way I can scroll through the slide. So, this isn't working. Is there a mouse? So hopefully this will work. So why might your child need a neuropsychology assessment? Professor Korf has described in some detail the physical and genetic manifestations of NF1, but we know from research that cognitive and learning difficulties are the most common complications of NF1 in childhood. I must say that these are highly variable, so children's difficulties might be quite mild and range to quite severe, and indeed not every child will have learning or behavioural difficulties. However, up to 80% of children do experience problems in one of these areas of intellectual ability, attentional skills. This is a very common problem, with up to 70% of children experiencing attentional problems and 30 to 50% of children being diagnosed with ADHD. Executive or high-level difficulties are common, such as planning and organisational skills, difficulties with perceiving visual information, speech and language, and not surprisingly, these cognitive difficulties can affect academic functioning, such as the development of literacy and numeracy skills. Actually just going... Sorry. So what we aim to do with our assessments is to provide early identification of language problems, motor difficulties, which is obviously important for early intervention. We diagnose intellectual disabilities, learning disabilities, so that the children can receive the appropriate supports that they need at school. We also screen for a range of commonly co-occurring conditions with NF1, such as ADHD, autism spectrum disorder, and mental health issues such as anxiety and depression. And if we find these, we then refer children to appropriate services, be it a psychologist, a paediatrician, or autism assessment services. And importantly, because NF1 is such a variable condition and every child with NF1 has different profile of strengths and weaknesses, a neuropsychology assessment is really the optimal way of understanding your child's profile of strengths and weaknesses so that they can receive the best care for their particular cognitive profile. So there are multiple components to neuropsychology assessment. First of all, we obtain a thorough developmental history, medical history. We collect information from parents and also sometimes from schools about the child's functioning at an everyday level. We assess the child in a one-to-one setting. This testing is very comprehensive and it can take anywhere from 2 to 4 hours depending on the child's age and ability to participate in the assessment. And of course, these sessions are broken up by rest breaks. And then we provide you with feedback on the findings of the assessment, including a neuropsychology report that enables you to communicate those findings to other people working with your children that will have some recommendations and strategies for management. So these assessments are provided through the NF1 Clinic here at the Royal Children's Hospital, and we see children up to the 18 years of age who are referred for having cognitive or behavioural difficulties. We're an assessment clinic at this stage, so whilst we liaise with schools and provide treatment recommendations, we're not a therapy clinic. However, it is our longer term aim, as you'll see from some of the research that I present, that we do provide intervention and therapy for children with NF1 in the long term. Usually children will be referred for neuropsychology assessment by one of the neurologists or geneticists in the NF1 clinic. However, it is possible for you as a parent to refer a child for assessment if you're interested in participating in one of our research programs, in which case you can contact Natalie, or I'm not sure if there's a sign-up sheet that you can sign up at the end of it, at the end of the presentations today. So I'd just like to move on to now describing a few of our research clinics. The first one, which is looking at the effects of NF1 on social difficulties and on the diagnosis of autism spectrum disorder. So we know that social difficulties are commonly reported in NF1. Parents and teachers anecdotally report that these children can be described as awkward with their peers, to have difficulty with making and keeping friends. They may be more commonly bullied and act younger than their age. Research has supported these anecdotal stories where on a range of measures children have been found to have greater difficulty with their social skills, so for example with their ability to identify and recognise social cues, to experience more loneliness at school and socially, to be more socially immature. And we also know from recent research that children with NF1 are at higher risk of experiencing autism spectrum disorder. And recent research indicates that approximately 10 to 25% of children meet criteria for autism spectrum disorder. So the research we're doing at the Murdoch is to further this research, because what we've currently got is primarily descriptive and we don't really know what are the underlying factors that are causing these social difficulties and the autism diagnoses. So our research aims to identify both the psychological and the brain processes that contribute to these difficulties. We'd like to identify early predictors for kids who will go on to have social and behavioural problems so that we can implement treatment strategies for them earlier. We'd like to improve the accuracy of the diagnosis of autism in NF1 and also to develop treatment programs to remediate the social and behavioural difficulties. So the children who are eligible for this study are aged from 3 to 15, and we have been collecting data on these children for the last couple of years and are continuing to do so. We are also recruiting typically developing children as controls so that we can compare our measures, the findings on our measures, to the children with NF1. And we're also collecting on data with children diagnosed with what we call idiopathic ASD, so autism in the general community, so that we can really look at whether the ASD we're seeing in NF1 is the same as the autism that we're seeing in the general community. As part of this study, in addition to the neuropsychology assessment that I've already described, parents are asked to fill in a range of questionnaires to look at children's social skills, such as their communication abilities, friendship skills. We also screen for autism symptoms with a questionnaire called the Social Responsiveness Scale, which I will talk to you a little bit more about in a minute. And if the child displays social problems on our screening questionnaire, we then offer the child a full autism assessment to make the diagnosis. And then we administer a number of other questionnaires to look at the presence of attentional problems, impulsivity, and a range of emotional problems so that we get a really full picture of the child. Children aged over 7 may also be invited to undergo MRI scanning so that we can have a good look at their brain structuring and functioning. This scanning is preceded by a mock MRI for children, which is like a practice MRI in a copy of the machine except without the large magnet in it, so that we don't put children in the MRI machine unless they're quite comfortable with being in it. This process lasts approximately 45 minutes, and children are allowed to watch a DVD of their choice while they're in the machine. And again, we hope that the findings of these imaging studies will help us identify the neurobiological bases of NF1 and lead to some treatment options. So I'd just quickly like to give you some very preliminary findings on the study. As I said, we've been collecting data here at Westmead in Sydney and also in Washington on this study. And just very recently, we've analysed data on 81 children who have participated in this study. Fairly equal sex distribution with 39 females and 42 males, ranging in age from 3 to 15. As you can see from the bar chart on the right, and unfortunately the pointer is not working, but we've assessed these children's intellectual functioning with one of the Wechsler scales, and you may know that the average IQ in the general population is 100, and the average range goes from 85 to 115. And you'll see that the mean or average IQ of the children with NF1 that we've seen is around 90, so well within but at the lower end of the average range, with about 70% of children functioning in the average range on this measure. You can see, however, there's very large variability with IQs ranging from 61, which is in the intellectual disability range, to 118, which is above average. I mentioned the Social Responsiveness Scale. This is our screening tool for measuring autism symptoms. This is a parent-rated scale that's sensitive to autism symptoms, and it measures a range of symptoms including social awareness, communication, cognition, motivation, as well as restricted interests and repetitive behaviours that can be seen in autism. And you can see, again, from the bar chart that nearly 50% of half the children with NF1 that we've seen have been rated as above the clinical cutoff on this scale. So parents are reporting mild, moderate or severe impairments consistent with ASD on this measure, which is obviously much higher than what we'd see in the general population. Out of these children, around 40 children who have screened positive for ASD, we have only yet assessed 24 of these children with a full clinical assessment for autism, and 9 of these children have gone on to be diagnosed with autism. So quite a high rate compared to what we'd find in the general population, supporting the fact that NF1 does put these children at risk of social problems and in some cases of autism spectrum disorder. Where our plans are to continue to collect data. There's a lot more data to analyse, and we will keep you up to date with that over the coming years. So just finally, I wanted to run through another couple of studies, and I will only briefly mention them, but I'm happy to speak more about them in the break. First of all, our Methylphenidate Study. You may know this as Ritalin, which we're looking at the beneficial effect of this in NF1 children, because so many of these children do display attentional problems and ADHD. Ritalin has been found to be effective in treating attention deficits in animal models, so usually mice or rats with NF1, and has been a first-line treatment for ADHD in the general population. It's been routinely used since the 1980s with no long-term effects on the brain identified. So this study aims to determine whether methylphenidate is effective in reducing attentional problems as well as the other cognitive and behavioural problems that we see in children with NF1, and children aged 6 to 17 who display attentional problems are eligible to participate in this study. It involves a 12-week trial with 6 weeks on the Ritalin and 6 weeks off the Ritalin, where they just receive a placebo, a sugar tablet with no therapeutic effect, so that people don't know whether their child is on the medication or not. The children are very closely monitored throughout this trial. You as parents receive objective feedback about the impact of the medication on your child's cognition and behaviour, and we also do cognitive testing before and after, as well as brain scanning before and after the medication to look at the effects. And then lastly, a more recent trial that we are beginning to recruit for is called the Coq Train Study, and this is an intervention trial that looks at the effectiveness of a home-based computerised training program called CogMed to improve attention and working memory deficits in children with NF1. Working memory is the ability to hold information in mind and mentally manipulate it, which is involved in a lot of our thinking processes, and it's very closely linked to children's success at school in maths and reading, as well as general cognitive functioning. So this training program involves a series of game-like exercises, such as the asteroids task you can see on the right, where they have repeated practice of simple visual, spatial or verbal span tasks, such as repeating numbers or pointing to sequences. Research has shown that in the general population, this training program has led to gains in working memory and attention in participants. So this program is about seeing whether it's effective for our children with NF1. We randomly allocate participants into another condition into this study as well, and that's so that we can really precisely determine the effects of the CogMed study, so that we, because children are receiving extra attention and intervention, we want to know whether it's actually the CogMed program that's leading to the improvement in working memory, so that a control condition that some participants will be allocated into is an online intervention targeting reading comprehension. So those children will receive a very similar amount of intervention, but this time focusing on their reading, and then at the end of the training sessions we can evaluate at the efficacy of each of those programs. The training involves 25 sessions conducted at home that can range anywhere from 5 to 9 weeks, and then we do an assessment prior to the program and after the program to look at the effectiveness of the program. Criteria for participation includes the child being aged 8 to 16. They must display working memories on assessment that we will test out beforehand. They need to have an English-speaking caregiver who can oversee the child's training practice at home, and children need to be of normal intellectual ability to participate in this study. So as I said, I'm happy to speak more about these research studies or the NF1 Clinic generally in the break, but I will pass on to Alice, who will speak more about the audiology study. But thank you to everyone involved in our studies, and also thank you to parents and the children with NF1 for participating in our studies so that we can move forward with learning more about this condition and how to best manage it.